Today we are going to start with the diagnosis and treatment planning in complete denture. So I'll be starting with the complete denture and Dr. Sham will continue with the fixed partial denture for your batch. So diagnosis and treatment planning in complete denture plays very important role in fabrication of complete denture. So these are the So basically, the diagnosis is defined as the definition is given by the glossary of prosthodontic terms. The recent definition is the determination of the nature of the disease. So basically, how the disease is progressing or the nature of your disease can be determined with the help of your diagnosis. So in Winkler book, the author of the book Winkler, he has given the definition, the examination of physical state, evaluation of the mental and the psychological makeup of the patient's understanding and the need of the patient with a predictable result. He has given this definition, but for the exam point of view, just write the first definition which was given by the glossary of prosthodontic term. That is the determination of the nature of the disease. So basically, what are the sequence of your diagnosis and treatment planning? So the first, what we do, first we grade the patient and we evaluate the patient in total, improperly. The next step is the taking the case history of the patient and recording it properly. Next comes the acknowledging all the risk, the medical and the dental risk for the patient. We assess it properly. After that, we examine the patient in a dental chair. The examination of the patient can be done intraorally and extraorally. Then we start evaluating all the histories, results, examination, and the lab findings. Each and everything will be evaluated properly. Then we fabricate a proper treatment plan. So these are the sequences of your diagnosis procedure. So what we do first, as the patient walks in your complete denture operatory. So first we notice is the patient's gait. It can be observed by when the patient is walking inside towards you or the towards dental chair. Okay, we can just check the neuromuscular coordination can be evaluated by the just observing the walk of the patient while coming in. That can be gait of the patient. Okay. The next is age of the patient. We have to write it down in the case history also. So the looks of the patient plays vital role from selection of the tooth till the aesthetics. Okay, we have to write and correlate age with the various. So various diseases can be there at different stages of the life. Please switch off your mics if it is on, so there will be no disturbance for the class. So the patient evaluation, we have to properly evaluate the complexion and personality. That will help you in the selection of team. The personality will help you in selecting and properly idealizing the smile for the patient. Okay. So we will determine the shade of the teeth with the help of your complexion and the personality. The personality will give you the proper characteristics of your tooth selection, the anterior teeth selection. So basically the facial skin complexion may be poor clinical indicator. So we don't use it as of now. Okay, that is very poor indicator for your selection of the tooth because it is. If you have any doubts, you can ask after the class. Okay. Don't raise your hand. This is the last warning. If you have any problem, you can type your problem in the chat box. I'll see it. Okay. It will be solved. If my voice is not clear, you can let me know. You can text it in the chat. Don't raise your hand unnecessarily. So the cosmetic index, I don't want anybody talking other than me. Shweta Chauhan. Also, if I see anybody talking, I'll just remove them from the class. Okay? So I don't want those people who talks while I'm taking the class. Okay. So the cosmetic index, it is one of the important index while making or recording any case history. So it can be classified on, sorry. So it can be classified into following categories. The first one is high cosmetic index, the second one is moderate cosmetic index, and the third one is the low cosmetic index. So basically it is about the aesthetic expectation of the patient. It can be categorized into three classes. So the most important classification is the patient evaluation. That can be the personality. Pause the share. Okay, so one of the main important classification was given by M.M. House in 1950. So basically, he given a classification based on the psychological response of the patient to adapting the complete danger treatment plan. So it is very important as for your exam point of view. So, so this is the first class, that is the philosophical type of patient. So this type of patient is very easygoing. He is very easygoing. He is mentally prepared for the treatment plan. He is well adjusted, very cooperative patient, and he is very confident about the dentist that he will get the proper treatment from him. Okay, and for such patients, we have the excellent type of prognosis while you are performing any complete denture patient. So the next type is the exacting type, that is type 2. So basically the patient is having a poor health, but it is not a great deal. So basically he is not willing for the accepting any suggestion from the dentist. So basically when you tell the patient to extract the tooth, patient is not willing in such conditions. So basically patient is dissatisfied with the previous denture. He is having the bad experience of the previous denture. That's why he is not willing for the treatment, and he's not willing to accept new suggestions from the dentist. Okay, he has some amount of doubt for the dentist while he is going for the complete denture patient. The next patient is the historical type of patient. So this is the very bad patients actually. They neglect their oral health. Okay, they are very phobic kind of patients. They don't have the proper willingness for the complete denture. They don't adapt to the new dentures. They have very bad experiences when the patient is taking new complete denture. Other previous dentures have the bad experiences. They have the unrealistic expectation. The unrealistic expectations means they want the tooth to be as good as the natural teeth. The artificial teeth which we are replacing should be the as good as the natural teeth. But this is not possible. This is quite nearly not possible. So in those patients, the prognosis is very poor. So the last uh, type of the evaluation is the Immun's classification is type 4, that is indifferent type of patient. They are not concerned about the treatment, the appearance, the dentures, nothing. They don't want the treatment, they don't use the dentures which you give. Okay, they are without the denture from last few years. They don't use it also. They don't have value or efforts, and they are not interested in the complete denture. So don't make sure that you are consulting the patient before start of the treatment. The type 1 and type 2 patients are good for application of any complete denture. The ideal patient is your philosophical patient. Okay. So this is the classification of mental attitude of the patient towards the complete denture, which was given by M.M. House. This will be a short answer question for you guys in the MOHS examination. So these are the other classification it was given. The classification given by the Shia et al. They also says that the patient is classified into three categories. The first is compliant patient, sophisticated, and the responsive. Okay. Also, the Winkler also has described four traits of the patient. The first one, who realizes the need of the prosthetic treatment. The second one, who wants the treatment. The third one, who accepts the treatment as it is. And the fourth one, who attempts to use the prosthesis but he cannot properly use it. Okay. These are the four traits given by the Winkler. Okay, we do. This is not properly for. So, how is the ideal patient? So, the patient is ideal when the patient is having a philosophical mind. That means that the patient is easygoing. He accepts all the treatments. He is willing for the complete denture. Okay. The next one is the willingness of the denture, and so willingness of the patient. and trust to the dentist. It is one of the most important criteria for success of your any prosthesis, not a complete denture, any prosthesis. The patient should be mature enough. Okay. He should have the realistic expectations. He should live the healthy and the life balanced life throughout. Okay. So the patient should not be dependent on anything. Okay. She should not prone to the other particular dental treatments. So the patients other than this are again divided into four categories. So what are the three types of dental patients needs? The first one is dentist should be liked and admired. Whatever we do should be admired. At least the patient should have the gratitude to admire you, the like you. Okay, he should hear you properly and respect all your instructions, and you should have proper control over the patient. This is the classification again, which is not required for you guys. So basically, when the patient comes, so nowadays this is not recommended. Okay, we so the handshake is very nice to greet the patient. It is one of the best method to greet the patient. But nowadays we maintain the physical distancing, so don't use this now. As of for now, okay, when this pandemic is over, this is the one of the best method to start the conversation. Okay, to shake the hand properly. Okay, there are the various types of handshake. So you will get to know about it when you start doing the patients. Okay. So the case history taking, when we start with taking the history of the patient, we do it in a systematic procedure. Okay, we take each and everything properly. The collection of the data is done properly, so that we can do a proper treatment planning in such a way that our treatment planning will lead to the proper and successful comprehension. So first, what we do, we ask the patient his or her name. It is really important for record keeping. Calling the patient, okay, it will give the patient a confidence, psychological boost, or the security to the patient while conversation. Okay. And the patient's family and community can be identified. It is quite difficult, but yeah, it can be identified. The age of the patient, the ability to wear and use dentures can be defined with the age. As the age increases, the patient have the ability to push. The patient will not respond to prosthetic procedures properly. So, age has various. Sorry, 1 second. So basically, the age changes in the oral cavity. As the age increases, we have various changes in the oral cavity. The first one is the slow healing. As the age increases, we have the slower healing rate. If the patient is having a trauma to the tissues, the healing of the tissues is very slow. Okay. There is the muscle coordination. The muscle coordination is reduced. We have the reduced salivary flow. The salivary flow is reduced due to the increase the age. We have the change in the quantity and the quality of saliva as the age increases. The elderly women, basically they are prone to the osteoporosis. As the age increases, there will be more amount of bone resorption in the patient. So that is considered as an age change in the oral cavity. That will lead to the osteoporosis in the elderly women. The rate of alveolar resorption is more as the age increases. So now sex of the patient is very important. So basically, depending upon that, we can change the size and shape of the tooth. The appearance of the tooth can be determined by the sex of the patient, and the certain diseases are common in the patients. Like now, just we have listened to the osteoporosis, which is more common in the elderly. So definitely, we have the other characteristics also. So there is a theory given by the Fresh and Fisher. For 1 second, we'll just take the attendance. There is a rendered theory which was given by Fresh and Fisher. What he states that, so basically depending upon the sex, he has determined some of the characteristics for the size and shape of the tooth. So basically in movements what we have the rounded incisor ledges that will give the patient a feminine look. There will be lesser angulation. The incisor ledges will have the curvature to be followed with the help of your lower lip. So the proper arrangement of the incisor edges to be done in a curvature with the lower lip. In male patients, we have the prominent canines. The canines are very prominent in men. So this is one of the characters. There will be no rounded incisor angles present. There will be more angulation to the tooth. So it is not. It is exactly opposite to the women. The cervical regions are more prominent in the male patients. So these are the some of the dendrogen concept. We use it as per the sex skills concept. So the patient's number is important to maintain the record. Address is again for the communication and the emergency procedures if it is required. Okay. The phone number, it is very important to convey any information to the patient from a dentist. Okay. Occupation plays vital role in the recording of the case history. The financial status can be identified by the patient, by the doctor when the patient tells his or her occupational status. The oral health can be determined with the help of the same. The religion and community, it doesn't have any much impact, but some of the patients need counseling for that also. The dietary habits can change from religion to religion, so that is one of the important factors. So we definitely ask the patient a nutritional, one second. We definitely ask the patient a nutritional status of the patient, the choice of food, the chewing ability, the patient is able to chew or not, if the denture bearing area of the tooth, denture bearing area of the complete denture is comfortable or not. If it is not comfortable, the patient will not able to chew it on it. So basically, if we don't have that, we try to maintain, record it in our case history and do the impression procedure and the other procedures properly. So the signs of nutrition deficiency, the first one is protein deficiency, vitamin deficiency, iron deficiency. There are various signs. In protein deficiency, we have the decreased salivary flow and we have the enlarged parotid gland. So we have to palpate the gland properly if the salivary flow is less. Okay. The qualitative analysis of the saliva can be done. Will come in the next slides. Okay. The vitamin B and iron deficiency will lead to the angular stomatitis, inflammation of the lips, lower lips basically. The chillosis, the corner of the lip is slightly inflamed. The tongue, there will be edema present on the tooth. There will be a magenta color atrophy of the filiform papilla and the burning sensation is very common when we have the vitamin B deficiency. In vitamin C, basically what we have deficiency, the edematous oral mucosa, there will be tenderness, redness, spongy gingiva, the spontaneous bleeding will be there. And the nutritional guidelines of the patient, so basically we ask the patient to eat a variety of the foods, build proper diet around fruits, vegetables, the whole grains, the breads, various type of breads. The English cereals will be added into the patient's meal. So in old ages, we basically ask the patient to have at least 5 servings of the fruits and the vegetables daily. So to maintain the overall requirement of the diet in the patient's regular day-to-day practice. So basically, we ask the patient to select fish, meat. It will have the rich in proteins, eggs, dried peas, and beans every day. The nutritional guidelines follow at least consume 4 servings of calcium-rich foods daily. Okay, so we have to add certain foods as per the requirement of the patient. The consumption of the water, juices, and the milk daily is very important. So we will continue with the medical history in the next class. So we have covered till the medical history. So it is very important diagnosis and treatment plan plays a vital role in the complete denture fabrication